Dry needling with Dr. Allie. So first she's looking for treatment zones or tender areas along the glute medius and the quadrates lumborum.
I can cut it.
So she's determined that these are the areas that she is going to treat via dry needling. So she is going to pick out her needles and she's going to begin the process. So once she's found that treatment zone and that treatment area, she is going to go ahead and tap that in and advance the needle until she has hit a treatment zone. So that should feel achy. Sometimes we'll get a twitch response as that muscle and that tissue grab onto the needle. And then she continues to palpate for some other treatment zones. And she finds one along that gluteus medius, and she's going to go ahead and tap the second needle into that spot. She's going to advance it until the patient feels
right there.
that it's a little bit achy, maybe a little kind of a deep ache sensation. Then she's looking at the skin response. So she sees a little bit of a histamine response here, so a little bit of redness around both of those needles, which really tells us that that's a good area that those needles need to be. So there's that redness along that QL and a little bit along that glute medius as well. So she's going to leave those needles in until they're quiet. So that means you're not feeling any achiness or any symptoms around them. And then she's going to go ahead and remove that needle. Okay, as that place really quieted out, we don't need to leave it any longer. So the patient is still feeling a little bit of achiness around that second needle, so we're going to leave that in until that resolves completely. So that could be a minute or two, sometimes that could be 15 minutes. It really just depends on what's going on with your system.
Yeah, there's just a very light hint of an ache still.
Okay, we'll wait a little longer then.
Okay.
So the patient reports now that that pain is gone. So she's going to remove the needle, and that's the end of the treatment.